How can CF patients prevent dangerous cross-infection? Imagine living with cystic fibrosis means being extra careful about germs that can make your lungs worse. Preventing cross-infection is all about stopping harmful bacteria and viruses from spreading between people with CF. The key is strict infection control. First, keeping physical distance is crucial. Patients should stay at least 3 to 6 feet apart from other CF patients, especially in clinics or social settings. This distance helps reduce the chance of airborne or droplet transmission of bacteria like Burkholderia cepacia complex or Pseudomonas aeruginosa. Next, respiratory secretions need to be contained. When coughing or sneezing, always cover your mouth and nose with a tissue or mask. Dispose of tissues immediately to avoid contaminating surfaces or the environment. Wearing a surgical mask when outside of your private room or when around other people, especially other CF patients, is highly recommended. Masks help trap droplets that carry bacteria or viruses, protecting everyone. Hand hygiene is one of the simplest yet most effective steps. Washing hands thoroughly with soap and water for at least 20 seconds or using alcohol-based hand sanitizers can prevent germs from spreading. Everyone involved in your care, including family members and healthcare workers, should practice good hand hygiene consistently. Cleaning and disinfecting equipment is also vital. Respiratory therapy devices, nebulizers, and any shared toys or tools should be cleaned according to established protocols. This prevents bacteria from lingering on surfaces or devices that could infect others. Avoiding shared spaces and social gatherings with other CF patients is another important step. Many clinics schedule appointments to prevent patients from meeting in waiting areas, reducing the risk of cross-infection. If you are attending a CF care center or event, follow all infection control policies, which may include restrictions if you have recently cultured certain bacteria like Burkholderia cepacia or methicillin-resistant Staphylococcus aureus. Education plays a big role. Staying informed about infection risks and following guidelines from CF foundations and health authorities helps you and your caregivers stay vigilant. Remember, even if your cultures are negative, your lungs can still harbor bacteria that might be transmitted to others. In summary, preventing cross-infection involves physical distancing, respiratory hygiene, mask use, hand washing, equipment cleaning, avoiding shared environments, and following strict infection control policies. These measures are supported by global health guidelines and are essential to protect your lung health and prevent worsening of your condition. Always consult your healthcare team for personalized advice and stay committed to these practices to keep yourself and others safe.